Digitalis. Introduction. Medicinal plants containing cardiac glycosides were well known to the ancient Egyptians, pharaohs, 3,000 years ago. Description of the pharmaceutical properties of such agents or extracts of the foxglove, which is the plant Digitalis berbera, were published in 1785 by William Withering, an English botanist and physician. Cardiac glycosides are the active principles in many plants including Digitalis berbera, Digitalis lanata, Mediterranean sea onion or sea squill, which grows in the Mediterranean Sea in Cyprus and used as fomentation for treating arthritis as a folk medicine. Oleander, lily of valley, and milkweed. However, some toads were found to have skin glands secreting biphenolides, which are similar to cardiac glycosides, so it is not considered nowadays as a botanical agents only. Chemistry. Digoxin is a prototype of such compounds which share similar chemical formula that is composed of two parts, the glycol part or the sugary part, which contains tridigitoxose cycles. The second part is aglycon or the non-sugary part. It composed of steroid nucleus and lactone ring. The other components or glycosides include digitalin and digitoxin. Anyhow, what you have to know that interruption of the glycon part will result in different chemical with different pharmacokinetic effect, and substitution of any chemical group at the lactone ring or position of the lactone ring attached to the steroid nucleus will change the pharmacodynamic effects. That's what you have to know about the chemistry of such compounds. Pharmacotoxicity. It is important to know that the aglycon part of the molecule influences the pharmacodynamics, while the glycon part influences the pharmacokinetics, as we said before. The pharmacokinetics. Absorption, digoxin. 50% of the oral dose is well absorbed, while digitoxin more than 90% of the oral dose is absorbed. Distribution and metabolism. These properties are plotted in the underlying table. It will be discussed in details in the lecture. Excretion. Digoxin is largely excreted unchanged in the urine. On the other hand, digitoxin is extensively metabolized by the liver and re-excreted into the gut via the bile. It has intrahepatic circulation. Renal impairment does not affect the drug plasma half-life or concentration. Pharmacodynamics. Action. Digitalis has two actions, cardiac action and non-cardiac one. The cardiac action in the form of increased systolic contractility, increased cardiac excitability, decreased the heart rate, direct and via vagal stimulation, decreased systolic filling time, prolonged AV conduction. This will be reflected on the ECG in the form of ECG changes with prolonged BR interval, short QT interval, and inverted T wave. That is what is known in the toxicology by Salvador Dali mustache. The second action will always or even usually missed by the students is the non-cardiac. The non-cardiac effect of digitalis is mild diuretic action. This will affect the clinical presentation and the lines of treatment used. Mechanism of action. Digitalis acting by blocking the sodium-potassium ATPase mediated pump with subsequent decreased intracellular potassium. This will result in increased myocardium contractility. The other mechanism is the increased cell membrane calcium with subsequent decreased resting membrane potential with increased excitability. Increased contractility and excitability are the targets of medical uses of digitalis in heart failure. Medical uses. Digitalis is the classic treatment of heart failure. Number 2, it is used in treating dysrhythmia. Actually, it is used for the supraventricular dysrhythmia due to its effect on the AV conduction. Digitalis toxicity. The mode of poisoning. It is almost always accidental or doctor-induced. Mainly occurs in the hospitals. It occurs during the use of digitalis in treating cardiac cases of heart failure. Also, it may be due to wrong ingestion by children. On the other hand, suicidal and homicidal cases are not reported. Actually, nowadays, as the number of patients with heart failure are increased nowadays, and these drugs are present in many houses, the patients or persons attempt to suicide can easily obtain these drugs in home, and the suicidal cases are nowadays very common. Fatal dose. For digitalis extracts 2 gram are fatal. Digitoxin 5 milligram. Digoxin is 10 milligram. It is to be remembered that fatal dose is an experimental number or measure. Fatal period. This is very rare, as most cases reported of intoxicated patients occur in hospitals, drug-induced or doctor-induced during digitalization. If this occurs, it would be expected in the first 24 hours. Clinical presentation. The first is first. You have to remember that the first manifestation to appear in digitalis overdosage is the GIT upset. The first of all is anorexia. This is followed by nausea, vomiting, diarrhea, and abdominal colic. Later on, there is yellow vision and visual disturbances. Also, there may be headache, delirium, and maybe convulsions. Late in the course, there will be cardiovascular manifestations, which are the serious one. It differs greatly according to the dose given. With small doses, there is irregular dichrotic pulse or bi-beat pulse, bradycardia, and hypotension. It is to be mentioned that the commonest type of dysrhythmia seen in digitalis overdosage is type 1 AV block. With larger doses, there may be a rapid pulse with or without ventricular tachycardia, ventricular extrasystoly, or ventricular fibrillation. Cardiac arrest or asystole is the end result. Treatment. Usually symptomatic and supportive measures, but specific measures may be used under certain life-threatening conditions, as in very high serum drug level, serious hyperkalemia not controlled, and serious uncontrollable dysrhythmia. So, the lines of treatment will be as in any toxin. It will involve 3 lines: general measures, specific measures, symptomatic and supportive ones. The general measures will be in the form of stop further administration of the drug immediately the condition occurs usually or almost always in the hospital. So you have to stop giving the drug. So it is an important measure to stop more and more digitalization. This is followed by emesis using syrup of ipecac, gastric lavage leaving activated charcoal, and saline purgative at the end of lavage is indicated. Gut dialysis or serial administration of activated charcoal is very effective. This is followed by establishment of patent airway and sufficient respiration. Specific measures. We have two drugs used in treating such condition. Number one is cholestyramine. It decreases the half-life of digitoxin from 6 days to 4.5 days. The action, it acts like activated charcoal by adsorption. It is excreted in the bile, so decreases the drug enterohepatic circulation of digitoxin. It is given 4 grams orally 4 times per day. It has an unpleasant taste, so better given with orange juice. Digoxin Fab or Digibind. It combines with the glycosides, forming inert Fab glycoside complex, which is easily excreted. On the other hand, it enhances freeing of the glycosides from the tissue binding sites, from the intracellular compartments, which render the drug more dialysable. The dose. Many equations have been postulated to determine the needed dose. The most simple are plotted in the underlying table. The third line is symptomatic and supportive one. The most important here is dysrhythmia and hyperkalemia. Dysrhythmia in the form of bradycardia. The only treatment for bradycardia in medicine is atropine. Atropine sulfate is given 2 mg intravenously. Tachyarrhythmia is treated by phenytoin 1 to 3 mg per kilogram intravenously, or propranolol 1 to 2 mg per minute intravenous infusion, then 10 to 30 mg over every 8 hours orally. For hyperkalemia, caixlate 20 grams orally or by enema every 4 hours is indicated. However, this drug is not found or present in Egypt. Insulin, it is given 10 units while infusing 5% glucose or dextrose to avoid hypoglycemia. It is to be considered to do hemodialysis in serious cases if the hyperkalemia is not responding to the treatment. Note beans. Hemodialysis is not useful in such cases or conditions as drugs has a large volume of distribution, drugs high plasma protein binding capacity, drugs has an extensive hepatic metabolism. Thank you.